we're doing today. My name is Dr. Danielson.
Nice to meet you.
Alright, so today we're just going to be checking your eyes. So first thing we're going to do is just take a look, and we're going to look at his pupils, his sclera, his conjunctiva, and we're just kind of looking to make sure that they're normal, round. We're going to look at his eyebrows, the lateral 1/3, looking to make sure that that's all good. Distance between each of them is normal, making sure there's no folding in or out of the eyelids. Then I'm going to come in and we're just going to palpate his lacrimal gland. See where that's at. Just make sure that that feels normal. There's no tearing or anything like that as far as that goes.
No pain.
No pain with that? Okay. And again, we're just going to be observing, making sure that everything's there. Next, we're going to inspect them using the otoscope. So we're going to come in on the side. I'm going to have this, I would already have this centered at about 15 to 20 feet out. Then I'm going to come in, I'm going to press this against, and then I'm going to press it in, hold his head with my left hand, and I am going to be looking for the, hold up here, let me do that. Looking for the red reflex with his eye. Then I would follow that in and find the red reflex, and then follow that all the way down to the optic disc, making sure that veins follow it down, looking for color, looking for size. It should be like a red background, and then the vein should follow back down to the optic disc, which should be like a yellow color. Hold up here. There we go. Okay. Everything looks normal there. So, okay, so now we're going to be looking for some accommodation of his eyes, making sure that everything as far as that is normal. So I'm just going to ask the patient to focus on the wall behind me. Then I'm going to ask the patient to focus on the tip of the pen. Okay, and behind me again. Tip of the pen. And I'm just looking for the pupils to accommodate and then dilate so that between the two, so they should enlarge and get smaller. Next, I'll just come over and I'll shine a light inside of the eye, and you should see the pupil accommodate. We'll do the other side. Again, you're looking for the reflex of the pupil, and then we're going to check it from the opposite side. So keep following it over, and pupil should accommodate again, and keep following it over. Pupil should accommodate again. Okay. Okay, and then now we're just going to do an H pattern. So I'm going to ask you to follow the light. So I'm going to go over, over. Good. Okay. Next, I'm going to ask the patient to focus behind me, and I'm just going to cover up one of the eyes, and release it, making sure that both sides stay straight. There's no like lateral deviation or medial deviation at all when that happens. So you should just see the eyes not have any reaction when you cover them up, and then do that. Okay. Then I would come behind the patient, and I would ask them to raise both their hands when they see the corners of my fingers. So I'll come in here. Alright, we're going to come in on top a little, and then I'm going to come over. There we go. Okay, and then if I had a Snellen eye chart, I would use that, but we don't have one here today, so we're not going to use that.